Hi, it's Dr. Vinay, and today I'm going to help you get prepped for your ACS session. We're going to talk about what you should do before your procedure. The number one thing is make sure you're hydrated. We want your veins to be full of blood so we can easily extract what we need to because we don't want to not get enough blood. Number two, just make sure you're not having any hair product in your hair that's thick or anything like fibers that's going to cause coloration. We're going to want to work on your scalp directly, and sometimes those things can affect our visibility or ability to get to the scalp. Oh, you don't have to shower the day of your procedure beforehand. Just follow your normal showering schedule. And I actually prefer that you take a shower after your procedure. We'll wash your hair to make sure we wash out all the gunk, but sometimes your hair can be tangled. So just plan to take a shower the night of the procedure, and you don't have to take one beforehand. See the next thing. Let us know if you have anxiety. A lot of people are afraid of needles or afraid of blood or just afraid of procedures in general. During the procedure, we can actually bring in something called nitric oxide. This kind of helps you dissociate from what's going on and helps you focus your attention somewhere else besides the procedure. Let's see. This one's interesting. Next one is avoid fatty foods the day of your procedure, because I've noticed when we spin down the blood, the plasma, you can tell that there's triglycerides or the fatty component of blood in there. And sometimes the blood is crystal clear when there's no triglycerides, or it can be murky. I don't know what this does, but I imagine that it could inhibit the results a little bit because the blood's not as pure. And okay, next thing is Tylenol. If you have a history of headaches, you can take Tylenol prior to your procedure, an hour to advance. Just take 650 milligrams. That's usually 2 pills. That's all you have to do to prepare. Okay, let's talk about pain next, because a lot of people are wondering if this is a painful procedure. The answer is not really. We really worked on the technique to control pain. Most people will walk out of the procedure saying this was way more comfortable than they expected, because you can read things online about PRP, but this is a different process with ACS. We're actually numbing your scalp, and you only feel a little bit of discomfort. But we have a way of doing it such that we can numb in a line and switch sides. So after one injection, we can make sure it goes numb, go to another injection site, do that injection, and then come back. So a needle won't feel anywhere near as painful. A little discomfort, it takes about 5 minutes. It'll be about 30 shots itself. And then it allows us to do 200 to 300 shots per kit of ACS without any pain whatsoever. Okay, let's talk about the procedure now, the steps to it, and what you should expect. Number one, we're going to draw your blood, and we're going to draw about 30 cc's or an ounce for every kit you're going to do. We need you to be hydrated, especially if you have small veins. So after we get the blood out, we're going to put it into a centrifuge. This is a machine that spins and it creates gravitational force. And what it does is separates the heavy cells from the light plasma. And then it also separates the dense cells from the light cells. And we're going to want to get the wound healing cells, the platelets, and the white blood cells for this process. So in the next step, we're actually going to decide what parts of your scalp we're going to use high concentration white blood cells. What parts of your scalp just need a low concentration. And if we have more kits, we get much more ability to treat at high concentrations in multiple locations versus using minimal kits. Let's see. Okay, after those cells separated, we get the ACS out, and now we're going to activate them. We're either going to do it mechanically by swishing around within the syringes, or we're going to do it chemically by using calcium, which triggers the response of these cells. Now, when we inject, it's all technique. We're going to inject right at the level of follicle, parallel to the skin. We're going to make injections anywhere from 3 to 7 millimeters apart. So you can expect nice, even distribution, so the treatment is really effective. All right, so that's the end of the procedure. We're going to go wash your hair now. There will be a little bit of plasma that tends to be sticky and have residue. Right after that, we're going to teach you the massaging technique. This is what you're going to do after the procedure to make sure you don't have swelling that reaches into your eyes or into your face. But we're going to hit into more detail in another video that helps you do aftercare. All right, we do have baseball caps, and we also have winter caps in case you want to walk out of here and you really should know what procedure. You can go home and you can shower the night of, and you just use lukewarm water. Okay, so going into aftercare now, number one thing is going to be massage. We just pumped a lot of fluid, remember, an ounce per kit, into specific areas. And the fluid that's in the front of the scalp is want to migrate down with gravity and it's going to get try to move down your face. Our goal is to keep that away from the eyes. What we're going to do is we're going to milk that fluid from the center outwards. And there's a technique that we use to do this so we can generate a lot of pressure. We're going to put our thumbs on the area where the swelling is. We're going to brace our fingers on the scalp, and we're going to use as much pressure as possible to push out to the sides and down in front of the ear where the drainage system of the face is. And if you do that, you will most likely prevent swelling. The time when swelling happens is when people don't do it with enough pressure. And when you do get swelling, it does suck, because when it gets to your eyes, they poof up. And it has to go through your face in order to get down. And that process can last about 7 days. So please massage afterwards, follow the protocol. We'll have another video on this. Or you can shower the day of. You use a lukewarm, even though we're going to wash your hair, but you probably want to get out tangles and things we couldn't really address. Right? Medication-wise, don't use NSAIDs. Don't use steroids, because these things will actually inhibit the inflammatory response. They're anti-inflammatory drugs. What we're doing here is actually using inflammation in our favor, so we don't want to inhibit that process. And I don't want you to use NSAIDs for the entire period of your ACS treatment, and that's about 6 months. But if you have to take it for like back pain or whatever for a couple days, that's okay. I just don't want you using it consistently, especially in the days after your procedure. If you have any pain after procedure, it's usually not a thing. Some people report throbbing with sensitivity to touch. Some people report headaches, but it's a low percentage. It's way less than 10% that will have something. And that's really it. These ACS sessions, we try to do them in a really comfortable environment in our office. You can bring your friends, you can bring your spouse, and it's going to be a lot easier than anything you read. Look out for the aftercare video after your procedure.